So we're just going to have a quick chat about CO2 lasers, so what we do in the Women's Health Clinic, how they work, what their action is and what sort of treatments can be delivered. These lasers are not new, they've been around for quite a few years now, and exactly how they work with tissue has been well documented over and over, and they're used predominantly in dermatology type clinics, so medical aesthetic clinics, and there's a variety of different treatments that can be delivered, from just simple skin rejuvenation to reducing acne scars, post-surgical scars, post-cosmetic surgery scars and so on. But also there's a slightly different handset that we use in our clinic where we deliver the UV treatment, where this is delivered vaginally. The process with Silvery Blue in the Women's Health Clinic is that particularly if we're using this for skin resurfacing on the face, is that we have to do something called a patch test. And the reason we do this is to ascertain a few things. So number one, the first thing we're looking at is your skin health and your general health. So are you fit and healthy, and is this a procedure that's suitable for you? Also it looks at what is your budget. So this is quite a high-end treatment, so it's quite effective over a short course. So some people will opt to have a single treatment, some people will need a program of treatments. And when we get together, one of the things we're doing is we're assessing that, so we will get you to do some questionnaires. So one of the things that's really important for the facial or the body treatments, not so much the NuV in the vaginal area, is that you have a patch test. And the reason for this is that we are trying to ascertain the most suitable level of energy to use, but also what you can tolerate. We're quite lucky, and I'm going to show a little demonstration with our machine here, is that there used to be two types of resurfacing. One was ablative, the other was non-ablative, so fractional, and fractional is what we're going to talk about today. In terms of the NuV, we have a very specific set of equipment that we use for that that's different to the face. Without being too technical, we're just going to show some shots on here. So this, we've got the handpiece here, and we're going to show that in a second, and this just demonstrates, this is what goes into the vaginal canal. So before we do a treatment, as it says in the NuV video, we do a full pelvic floor examination, and we're ascertaining what level of treatment we're doing and where. And the good thing with this laser is that once you've connected the laser head, okay, so the beam comes out of the machine through here to the right angled mirror, and what we can see is, by looking at what we've examined with the patient and where to treat, we can target the tissue specifically. So the other thing that we use is we put in a small cage, and that's just to protect the tissue, because vaginal tissue is quite rugged, and what we don't want is to be sort of twisting people in what it feels like is not. So this is just there to give us something smooth to move against. And you won't feel a great deal, you will feel the motion of the movement, and you'll see the laser when we do a fire in a second, how that's delivered. When we've finished the internal part of the treatment, which is 3 passes, takes no longer than 10 to 15 minutes for the whole procedure, we then use one of the open handsets. So with these we can direct them to where we need to apply them to the tissue, but similarly also block things that we don't want to injure, so things like, for example, the clitoris. But it also means we can really finely tune this to things like episiotomy scars, to perineal tears, loss of volume to the labia as well. Okay, so I'm just going to demonstrate the difference between the skin rejuvenation and the vaginal rejuvenation equipment, just to give a bit of background. So this has got a little lens on it, so the laser beam will come from here. This will be applied directly to the skin. Okay, so it means that we can really focus and target. We've got a nice little air blower here. So because it can get a little bit warm, remember this is reacting with the water component in tissue, is it just gives a little bit of more comfort as it's firing. So the beauty with this particular device is that we've got 3 settings. So traditionally with CO2 resurfacing, there was ablative resurfacing, which has got quite a long downtime, a bit more risk of complications, but very effective in its day. But it's now been replaced with what's called fractional resurfacing. And what that means is we have what's called microthermal zones. So they create small areas of injury, which means that there's some areas that are unaffected. So what that results in is less downtime, less risk of infection. The only negative to that compared to the ablative is that it can take a bit longer to get the results. So traditionally a programme of treatments is recommended, so anything from 1 up to 3, and that's something that can be advised when you come to clinic. When we do a test patch, we use 3 different settings. So we're quite lucky, so we've got the skin resurfacing, which is sort of the traditional fractional surfacing which is out on the market that most clinics can do that have got CO2 laser. We're quite lucky, this machine has been developed and devised so that we've got some slightly less aggressive to the field treatments, but they give less downtime. So typically the downtime for skin resurfacing could be where there are marks, or you can tell something's been done, typically for about 7 to 10 days. With the middle setting, so the rubbing setting, it's about 5 to 7, and with the peel setting, it's about 1 to 3. So what I'm going to do, I'm going to demonstrate on a tongue depressor, which is very dry. It's a dry piece of wood, so it will look quite dramatic, because remember this laser's looking for water. So we're going to try it on the tongue depressor, so our dried wooden stick is the laser peeling. A preset comes up, and for ease, when we're looking at getting patients to look at the patch test, we might just change the shape. So typically I will choose a triangle because we tend to forget what we're told. So you can see the aiming beam, ready, steady, splat. Okay, I'm just going to show what it looks like on the skin. So I'm going to start with skin resurfacing. I'm going to stick with a square. There we go. You can see the red line there, so that helps us to mark out where we're going. Let's turn it that way, ready, steady, splat. Okay. So the white areas are where we've reacted with the water, so instantly you'll see a reddening around that area, so that is your histamine response. So similar to when you work, get injured with stinging nettles, that kick-starts the first part of wound healing, which is the inflammatory. Slightly different handset, so we're not doing skin rejuvenation on face or body. So we need a new handpiece, so this goes all the way around, so it means that we can keep rotating. So again, same principle, the laser beam comes down, okay, so we can see that goes round and round. First things first, this will be inserted into our patient, and the laser head is there with the mirror. So what will happen now is I can connect this, and I can choose exactly where I'm going to be targeting this tissue based on my examination of the patient. So if there's stress incontinence, typically we'll work around the anterior, the top wall, around the entrance to the wee tube. Okay, so it means that we can target that. So this is a strange sensation, okay? So what I'm going to do is I'm just going to fire this onto the brown tongue depressors just to show what the shot looks like. So it will do what's called scanning, so you'll hear it. Okay, so remember this hits the mirror that I've just removed from this handset, so this concentrates this to the vaginal wall. Ready, steady, go. There's no smoke when it's patients. Remember this is a wooden stick that's as dry as bone and it's looking for the water. Okay, so you'll hear it. I'm just going to do another shot again, so you'll hear it scanning. And then when we've done that, we remove all the handsets from inside the vagina, and we use one of the 2 external handsets. It doesn't matter which, it's down to the nurse's preference depending on what she's discovered on the examination. A slightly different setting. And this, in terms of sensation, feels a little bit like an elastic band twang. It's a little bit of sensation, but it doesn't get any hotter. So with this one, if you have a look there, ready, steady, splat. Okay, slightly different. But what it means with this is that I can actually, I'm right up against the tissue, so I can get really close to structures. Okay. So again, it's all about tailoring the treatment, so it's individual for the patient.